In Stranger Things, Will Byers gets nosebleeds because he's hijacking Vecna's mind to steal his powers. But in the real world, if a young male like Will Byers has recurrent nosebleeds, it's not Vecna. It's likely a hijack of different kind. We need to rule out a rare tumor that is juvenile nasopharyngeal angiofibroma, which is the most common benign tumor of the nasopharynx but highly vascular and locally aggressive tumor. And it originates from the sphenopalatine foramen. Coming to the clinical clue, this tumor is usually seen in the young males in the age group of 10 to 20 years, and they usually present with the complaints of recurrent epistaxis, broadening of the nasal bridge, proptosis, swelling of the cheek, infratemporal fossa, or involvement of the second, third, fourth, and sixth cranial nerves, which depends upon the extent of the tumor. Because of this mass, the patient might complain of the progressive nasal obstruction and hyponasal speech as shown in this video. And if this mass obstructs the eustachian tube, the patient might suffer from the hearing loss and otitis media with effusion. Sometimes this tumor can present like this as shown in the image, and you should never ever digitally palpate this tumor or do the biopsy, as it can lead to profuse bleeding because it is a highly vascular tumor. On nasal endoscopy, you can observe red fleshy globular mass as shown in this image. On CECT, you can observe bowing of the posterior wall of the maxillary sinus. This sign is called antral bow sign, which is also known as Allman-Miller sign, which is pathognomic for juvenile nasopharyngeal angiofibroma. Coming to the staging, which is known as Radkowski staging, it first spreads medially, that is nose or nasopharynx 1A, sinuses 1B. So in medial spread 1, nose, nasopharynx, sinuses. 1A includes nose and nasopharynx. 1B includes sinuses. Now it spreads laterally, which is indicated by number 2, and minimal spread in the sphenopalatine fossa as 2A, and completely fills that fossa and orbit as 2B, orbit B 2B, and goes to the infratemporal fossa as 2C, and then it goes into the head, intracranial extension, minimal as 3A and extensive as 3B. Coming to the treatment, primarily will go for the preoperative embolization of the maxillary artery and surgical excision of the tumor. If it is unresectable, we'll go for the radiotherapy.